There's something different about people who saw iron lung machines in hospitals as children. In a world where medical equipment is hidden behind sterile walls and cheerful decorations, these individuals encountered the most frightening and life-saving technology of their generation face to face, and it shaped their psychology in ways that created the most medically aware and resilient generation in modern history. Let's start with something that sounds like science fiction but was medical reality. Picture yourself at 7 years old in 1949. Your mother takes you to visit your cousin in the hospital, and she stops outside a large room with glass windows. "Don't stare," she whispers, but you can't help yourself. Inside that room are massive metal cylinders, each one containing a person with only their head sticking out. The rhythmic whooshing sound fills the hallway. These aren't just machines, they're breathing for people who can't breathe for themselves. The nurse notices you looking, and comes over with a gentle smile. "Those are iron lungs," she explains in the matter-of-fact way that adults talked to children in those days. "They help people breathe when the polio makes it hard for their bodies to do it on their own. The machine does the breathing work, so the person inside can rest and get better." You'd heard about polio, of course. Every child in America knew about polio. But seeing the iron lungs made it real in a way that no conversation or warning ever could. These weren't just stories about getting sick. This was what happened when polio attacked your breathing muscles. This was the line between living and dying, made visible in polished steel and rhythmic mechanical breathing. Think about what happened to your developing brain in that hospital hallway. Most children your age were protected from seeing serious medical equipment, but you were face to face with technology that was literally keeping people alive. You were learning that medicine wasn't just doctors and nurses being kind. Medicine was machines and science and human ingenuity fighting against death itself. But here's what made this experience psychologically profound. The iron lungs weren't hidden away or treated as something shameful. They were right there in the open, where family members could visit, where children could see their siblings or friends or neighbors. The medical community understood that hiding these machines would create more fear than showing them. Your cousin was in a regular hospital bed, recovering from a milder case of polio that hadn't affected her breathing, but she could see the iron lung ward from her window. "Sometimes I talk to them," she tells you, pointing toward the room with the machines. "The boy in the blue iron lung likes baseball. The girl in the yellow one is teaching herself French from a book her mother holds up." This was your introduction to something psychologists now call dignified medical intervention. The people in the iron lungs weren't patients hiding from the world. They were human beings adapting to extraordinary circumstances with remarkable grace. They read books, held conversations, maintained relationships, pursued interests. The machine that looked so frightening was actually enabling normal life to continue. You watched as nurses moved efficiently around the iron lungs, checking dials, adjusting settings, cleaning the machines with careful attention to every detail. These weren't mysterious contraptions operated by wizards. They were sophisticated tools operated by trained professionals who understood exactly how they worked and why they mattered. This created what medical psychologists call technology trust imprinting. Children who saw iron lungs in operation learned that complex medical equipment wasn't something to fear, but something to respect. That machines could be allies in healthcare, not obstacles. That the scariest-looking medical intervention might be exactly what saves your life. Now imagine visiting the hospital again several weeks later. Some of the people who were in iron lungs during your first visit are now in regular beds, breathing on their own. Their chest muscles have recovered enough function that the machine is no longer necessary. You're witnessing not just medical treatment, but medical triumph. The iron lung wasn't a prison. It was a bridge between sickness and health. But you also notice that some iron lungs now contain different people. Some patients who were there before are gone, and you're old enough to understand what that might mean. The iron lung ward taught you something that many children never learn until much later. That medicine is powerful, but it's not magic. That doctors and machines can do incredible things, but they can't save everyone. This developed what researchers call realistic medical optimism. Unlike naive faith that doctors can fix anything, or cynical belief that medicine doesn't work, you learned a more nuanced understanding. Medicine works best when it's applied early, when patients follow instructions, when families support the treatment process, and when everyone involved understands that recovery takes time and effort. The iron lung experience also taught you about adaptation in ways that would shape your entire approach to life challenges. You saw people who had lost the ability to breathe independently, and instead of giving up, they found ways to live fully within the constraints of their situation. They read, they talked, they planned for the future, they maintained relationships. This created what disability psychologists call adaptive capacity modeling. You learned that human beings can adjust to almost any circumstance if they have the right support systems, that limitations don't automatically mean the end of a meaningful life, that technology can extend human capability in ways that restore dignity and possibility. But perhaps most importantly, seeing iron lungs taught you about the collective nature of medical care. Every machine represented not just one patient, but an entire network of people working together. Engineers who designed the equipment, manufacturers who built it, nurses who operated it, doctors who prescribed it, families who supported patients through it. You understood that when someone got polio and needed an iron lung, it wasn't just their problem. It was a community challenge that required community resources. The hospital ward with iron lungs wasn't just a medical facility. It was proof that human beings take care of each other when taking care of each other requires extraordinary effort. This created what public health psychologists call healthcare system comprehension. You developed an early understanding that medical miracles don't happen spontaneously. They happen because societies invest in research, training, equipment, and facilities. That the iron lung working to save your neighbor's life existed because thousands of people had worked together to make it possible. Years passed, the polio vaccine was developed. The iron lung wards gradually emptied as fewer people contracted the paralytic form of the disease. You moved on with your life, but the lessons from that hospital hallway stayed with you forever. Decades later, when you or your family members face serious medical challenges, you approach them differently than people who never saw iron lungs. You understand that the scariest-looking medical equipment might be exactly what you need. You trust that technology and human skill can work together to achieve remarkable results. You know that adaptation is possible even under the most difficult circumstances. Now imagine trying to explain to your grandchildren what it was like to see iron lungs in operation. How those massive metal cylinders weren't symbols of medical failure, but proof of medical determination. How the people inside weren't victims, but fighters using every available tool to stay alive and stay connected to the world they loved. This isn't nostalgia for more dramatic medical times. This is recognition of a fundamentally different relationship with healthcare, technology, and medical reality. You learned that medicine is both art and science, both technology and humanity, both individual treatment and collective commitment. When younger people express anxiety about medical procedures or complex healthcare equipment, you carry knowledge that could help them. You understand that the most intimidating medical interventions are often the most life-saving. That trust in medical technology, when combined with realistic expectations, leads to better outcomes than either blind faith or excessive fear. Your childhood encounter with iron lungs taught you something that no amount of health education could convey. That human beings can survive and thrive under conditions that seem impossible from the outside. That medical technology serves human dignity rather than replacing it. That the best medical care happens when patients, families, and healthcare providers work together toward shared goals. Those hospital visits to see iron lungs weren't just family obligations or childhood trauma. They were masterclasses in medical reality, technological adaptation, and human resilience that shaped how you approach health challenges for the rest of your life. Drop a comment and share your iron lung memory. Did you see them in hospitals? Did you know someone who used one? How did that experience shape your relationship with medical equipment and healthcare? And if this resonated with you, hit like and subscribe, because we dive deep into the psychology that explains how your unique childhood medical experiences shaped the remarkable medical wisdom and resilience you carry today. See you next time.